So we talked about sinus rhythm, and sinus rhythm, we know when we're talking about sinus rhythm that the R to R is equal. The PR interval is 0.12 to 0.20. So this is regular. The P to P is regular. The P is upright. There's a PQRS, then T wave. And we know that the rate is 60 to 100. We also know that with sinus bradycardia, we have all these same rules. Everything is the same, except that our rate is below 60 or less than 60. Right? Less than 60. So, sinus bradycardia can be normal. There may be nothing wrong with the patient. The next topic we're going to talk about is sinus tachycardia. And sinus tachycardia, abbreviated ST, again has all of the same characteristics as sinus rhythm, as sinus bradycardia. The only difference being that the rate is 101 or higher. So it's just faster. It's 101 or higher. No difference. Sinus tachycardia is just faster. Is sinus tachycardia normal? Well, sinus tachycardia may be normal. It may be normal in a situation where someone just exercised. They just ran. They were frightened. If you're frightened, your heart rate is going to go way up. So it can be a normal finding. Someone that has a fever may be tachycardic. Somebody who was frightened, someone who just ran. If you have respiratory problems, you're going to be tachycardic, have a higher heart rate because you're short of breath. And when you're tachycardic, when you can become short of breath. So it's kind of a catch-22. Also, respiratory medications, many of them will actually increase your heart rate. So it's not uncommon to see someone who has a respiratory problem, a breathing problem, whose heart rate's a little faster. Now, if I'm sitting on the couch watching TV and it's not a scary movie and there's nothing weird going on and my heart rate is 110 or 120, that's certainly abnormal and needs to be investigated. So sinus tachycardia, depending on the circumstance, can be normal. It can be a finding that is not concerning. However, it also can be something very concerning. If someone's normal heart rate is 60 when they're doing nothing, and now they're doing nothing and their heart rate is 120, something is going on. So we need to investigate that.